Hi, everyone, and welcome to the EMSC for Children Innovation and Improvement Center PMHCA Quality Improvement Collaborative office hour. Today is March 26th, and this is for all who are trying to expand their projects to the ED. However, the information shared here is not for ED projects only. It could be relative to your other work. So hopefully we'll introduce some new or refresh some old aspects of your work, and it will align with healthcare QI principles. As a result of this work today, hopefully will refresh some of those principles. So from 3 to 4, we will have an opportunity to work with QI coaches such as myself, Anna Goldman, and Jen Donathan. Just a reminder, Jen has over 10 years of experience in project management work and QI science in healthcare with healthcare organizations. And then at 4 o'clock, we will be joined by Logan Strauss. Logan is a data scientist at University Hospital's Rainbow Babies and Children Hospital with extensive experience with everything to do with data. And at 4 o'clock, this session is for beginners, somebody who is maybe just looking and matching their knowledge of their QI science information that they had previously, or using with data basics like identifying nominators, denominators, something that for example, I've forgotten before I started this position a couple of years ago, and it was so nice to have Logan to refresh our memories, and hopefully we'll have a good time there too as well. It's also an interactive experience. I am hoping we'll have a little bit of time in between the 2 sessions and give you like a 5-minute bathroom break. So with that, we will get started. Anything that I missed, Jen, please add them. All right. Okay. All right. As you're beginning the exploring the ED space, we are going to look at reviewing the ED care pathways with ED engaging emergency departments, ED toolkit. So our toolkit is also a reminder, actually structured so it is following the QI components of QI science for healthcare. So we will go back and forth reintroducing some of the concepts that are in the toolkit that would align and assist our work here as well. We will be talking about stakeholders, the ones that you might need to begin your work, or the ones that you may be using and maybe recognizing you're not having everyone at the table. So we'll discuss those opportunities and talk about different pathways of action for your team and the next steps. Jen, please chime in if I miss any.
No, you're good. And again,
Great questions.
Yeah, and I think for folks, again, as Anna alluded to, if you are still just maybe in the very early stages of ED exploration, or again, you aren't working with EDs explicitly right now, these are really good tools and resources to help guide you. Maybe not necessarily the ED workflow, but a lot of the principles will apply to your current work as well.
Mm-hmm. So this slide might be new to some, but might be old to others who've been engaged in this work. So this is actually how we start our toolkit, and in our first page talks about the ED care flow, the considerations that providers are needed to be paying attention to at different stages of the work as our kids in crisis come to the emergency rooms. So the first stage is triage. Second is screening. A third is ongoing assessment. And the fourth one is disposition. At each stage of this work, as kids flow through the emergency departments, at some point of time, there will be a decision to discharge kid back home in the community, home or other environments, or in discharge to the move on to the hospital acute admission. So I probably can talk about this for another hour. We did have a webinar, I believe January 5th, if you guys want to go back to that, where one of our experts, Angela's last name escaping me right now, who has described opportunities in each stage of the workflow during that time. As well, I want to bring it up, and we'll talk about that at the later time today, is this under kind of having an idea of what's happening in the ED, what instruments are being used, what screens are being administered, and assessments being done, determinations and recognitions of different issues that arise, are very good first steps into beginning your assessment of the environment, what is happening in the ED, and what are the things that are relevant, and how can we link our efforts together, meaning PMHCA and the ED. And if you'd like to learn more, again, we'll talk about that as well. And actually, this is not, I don't know, is it in our toolkit yet or not? What I'm thinking is, Jennifer, is those fireside chats that we had with different, oh, thank you, Hannah. Yes, it is. It's a fireside chats that we have with ED experts that are discussing with ED audiences. And that was done last year with one of our collaboratives through EIC, ED Stop Collaborative, related to suicide prevention, pediatric suicide prevention. That does give you a very good in-depth ideas of how to approach ED's opportunities, and each stage and each consideration. As you hear, you see the right column here describes the elements of some considerations as the kiddos go through the ED processes. Anything to add in this? Did I miss any? Oh, thank you, Hannah. Hannah is just adding a link in our chat. Please take a look at that. And again, those are available at all times, so we don't have to dive into it today, but it's just a reminder to know that it's available for everyone at any time on our website. All right, and we will be discussing the next steps in the next slide. Jennifer, before we jump into it, was there any other considerations that I might have missed on the previous one?
No, and again, Hannah shared a link on what the ED Stop Suicide Collaborative was. So those were emergency departments who were participating in their own quality improvement collaborative, specifically focused on acute suicidality of pediatric and adolescent patients, in the ED. Mm-hmm. So they were all focused on, I believe, 4 or 5 different clinical care bundles around acute suicide in that setting. So some of it is pretty technical and clinical heavy. However, it is really beneficial to give you a lens as to what ED providers are thinking about, what kind of considerations they need to be making when addressing pediatric mental and behavioral health as it moves throughout the emergency departments. So highly encourage you to look at those fireside chats. They are incredibly valuable. I think we learned a lot. And I think even our PMHCA teams who participated with us in our TA development were able to sit in and listen to a lot of our ED Stop Suicide participants. Thanks, Eleni.
Thank you. Thank you, Eleni. We have Eleni in our team here too. Thank you so much, guys. Okay, so let's dive in here. Next, stakeholder analysis sounds very like an expensive wording here, but it's actually very simple. So who are the people we need to having information, sharing information, before we even begin thinking about ED work? And then sometimes we realize the stakeholders that we have participated with before, partnered before, are actually great assets in our ED work, and as some of our teams are discovering. So right now we'll do a little bit of an exercise, and this is, again, please participate with us, because that's no fun if we don't. We'll look at possible stakeholders that could be interested in your ED expansion project, And they're listed here, but it's certainly not a limited, not a full list. So clinicians, administrators, patients, EMC state partners, community organizations, family may be included on the list, and others. So in this process of identification of a stakeholder, what we're looking to achieve is to assess interest, influence, and resource allocation. We do have a template for the stakeholder interview that you're welcome to use. We will share that in the next few slides. And with that, I think we're gonna, we have this nice visual. So our problem is we're trying to increase access to. Okay, we might need to mute somebody. So the problem is whatever the problem we're trying to achieve. In our case, we're trying to increase access of pediatric mental health in the emergency rooms. So here you see we listed possible stakeholders. So that's the beginning of the stakeholder analysis, and hopefully you guys are seeing and thinking, well, let me look at this and figure out what would be helpful for my organization and what stakeholders do we already have, and start connecting the dots. It's kind of messy, as you see here. We have a problem and different stakeholders. So we'll start hopefully using the whiteboard at this time, and I'll let Jennifer help us with getting that going, where you'll be able to participate by hopefully placing a idea of a stakeholder or somebody that you're already using in your organization on the whiteboard. All right, am I doing this, or are you able to share?
I'm taking a look. Did you create one ahead of time?
No, new whiteboard. How about this?
That works.
Yeah. Do you guys see it?
Yes.
Okay. So the whiteboard, how it works, you have to, on the left side, there says a sticky note. So click on the sticky note, click the size or the rather the color, and then you'll be able to type on the sticky note. Takes a little time, but I am more than sure we'll get into it. We'll get to it. Okay, sticky note. I see sticky notes, but I don't see the typing. If you guys are typing, that's great. We'll just
So this
okay.
Yeah, so this exercise, what we really want you to do is think about, you looked at that image of, think of the thing that you're working on, what your team is looking to do, and it's ED expansion work. So think of the different stakeholder groups that you might want to engage, and it can be anybody. You can just type them on the sticky note. It could be, administration, it could be community leaders, it could be providers. One sticky note per stakeholder.
Yeah. So at the left, you should see the bar that says sticky. There's several options, but you want to click on the one that has like a square rectangle sticky note. So click on that and let us know if you're struggling to type in. Okay, somebody's typing administration. All right, doesn't have to be perfect spelling. That's all great. Parent. Okay, emergency department. Great. Community. Thank you, guys. Again, if you're struggling, just put it in the chat. We'll look there as well. Community leaders. Okay. ADs, administration, law enforcement. Yeah. Okay. Nurses. Advisory council. Love that. Okay. Emergency department nurses, scheduling coordinators. Yes. EMC state partners. Okay. Who else? There anybody we haven't? Social workers. Okay. Yes. Let's see. ED social workers, PCPs. Yes. School administration. Very good. Okay, first responders. Got them. Okay. All right, looks like we are still typing. Okay, community leaders. Okay. Parent engagement. All right. So what I have are emergency department nurses, scheduling coordinators, first responders, law enforcement, advisory council, social workers, PCPs, ED social workers, administration, school system, EMAC state partners, parent engagement, utilizers. Utilizers meaning, I'll just wait for that person to maybe end it. It'll be nice to know. Community leaders, nurses, school administrations. All right. All right, let's see. Let's check the chat. I think we missed. So far, don't see any additions to us here yet. Community mental health services. Yes. Yes. Front desk staff. Yes, very important. Those are people who are actually going to connect us to our partners.
Now this is looking great.
Yeah.
I'm going to start grouping some of these to see if I see some commonalities.
So we're seeing some ED social workers, that I'm not sure if that community social workers or just social workers. Okay. And then just for awareness, not every ED would have a social worker, but those are great partners. Law enforcement, advisory council, parent engagement, youth and parent peer specialist and advisory. Administration.
Not sure if I wrote that or someone else did. Maybe I wrote that one. Like
Okay.
hospital administration.
Yes, yes, hospital administration. That's great. Okay. Well, looks like we've gotten all the answers here.
I think this is pretty good. So as you can see, there's a lot of different stakeholders that you can engage in this work. And I like that people have taken a pretty well-rounded approach, whether you meant to or not. Even if you're focused on ED specific expansion, you do need to consider those stakeholders out in the community, such as your school system, your PCP, because they're also part of that care continuum. Once a patient leaves the ED, what happens then? This is great.
Yep.
Cool. I think we're good on stakeholders.
All right. So back to the presentation. Thank you, guys. So this is an exercise. I just wanted to think about this a little bit. As you're beginning to learn more about ED expansion, for some of you who are new or you're have been at it for a while, you would start noticing the trends of the stakeholders. We did forget to say HRSA. Yes, HRSA is a stakeholder as well. And so as we begin thinking through who are those stakeholders, it would be important to then what we call a stakeholder, to use a stakeholder grid. So this is in a nutshell of a few steps you can use. It's almost like for me, it's like mindful reminders when we are analyzing stakeholders. So identifying who they are, what is the relationship between you and a stakeholder, your PMHC and a stakeholder, and then we would evaluate and analyze what are the interests and objectives for each of them. Basically, what's in it for me, or what's in it for us from this relationship, and then deduce or decide the future measures. What are the things we can help each other with? Um, so that's kind of in a nutshell. Um, and I would let Jennifer add. I'm sure I missed something here.
No, I think you're good. But I think
Yeah.
as you're thinking of your stakeholders, it's not just, so who do we think wants to, sit at the table with us? There's a lot of different considerations to make when you're thinking about the people who you want involved in the work. And maybe not even involved in the work too, as we'll see in the next slide, and to what Anna alluded to, is that these stakeholders will serve various roles. Some are going to be very integral in the actual day-to-day work of what you're trying to do. Others are there from more of a as need to know basis. Again, it might be, hospital administration. They're probably not going to be the ones who are going to be in the day-to-day work with you, but they'll definitely want to be kept up to speed on what's going on and how it's impacting their staff. And then probably, also just as important is HRSA. That's a very important stakeholder to consider and involve in those conversations and those considerations.
Thank you. So after identifying the stakeholder analysis begin. Because it is necessary to determine which stakeholder need to be invited to which meetings, right? It might be unnecessary to ask engagement of all stakeholders at the same level of intensity. For example, we would not be inviting our HRSA partners to every meetings we have internally with our department when we're identifying steps of the process, right? So that is what this is just one example I can provide here, but that's the grid that can help us determine that. Some of the stakeholders, you might just need to keep aware by email and letting them know that things are happening. And this is our progress. And some of them are going to be much more managed closely, and we're looking at I'm thinking like the ones who do the work for consultation line, for example, in the ED department, with this, as we all know, aware, staff turnover often, where we need to make sure to know, oh, did the other new people know the process? So those are the ones we need to be actually both could be monitoring and managing close. So with that in mind, we were going to use a little bit of time to identify those stakeholders who could be in different quadrants of this grid, um, and maybe have a little discussion too. I'm not sure if our whiteboard will is ready for all the interactions, but here we invite you to brainstorm with the stakeholders that we had in previous exercise. Which quadrant would you put them in, and why? And I'm gonna just let you guys unmute and let us know what you think. So the horizontal line is power, right? How powerful this stakeholder is for our project. And what did I not say? Right, the vertical line, I'm sorry. And the horizontal is the interest, how high of an interest the stakeholder could be for our project. Well, don't all go at once. HRSA, yes, HRSA, Gabby. What kind of stakeholder would they be? If we were to practice putting them at this grid, would they be the ones we want to keep satisfied, or the ones we want to manage closely? Manage closely. Okay. All right. Anybody else?
I just dropped a list too of some of the ones that were
Oh,
listed.
thank you. Yeah, so okay, I'm gonna go by participants. All right, who do we want to pick at? Well, how about Amy? Amy, what stakeholder do you think should go in a manage closely quadrant from the ones that Jen shared? Christina or Anne, anybody?
Well, I'm just thinking about the partners we're starting to meet within the emergency department, which are mostly the professionals, and involving them from the get-go. We have internally some planning we're doing, developing the model, getting their feedback, but so keeping them involved in many of the steps. So I don't know, I guess that's manage closely, keep informed, but it's high level of involvement, or if they're not engaged and invested, it's not going to happen.
Thank you, Anne. Yep, it's great. How about guys, the police? I'm thinking the law enforcement agencies. Where would they be?
Feel like they need to be kept informed as to the services if they are on a response, but they need to be aware of what services to take somebody to for triaging. So I was thinking about that. And when I put in first responders, when ambulances are sent out, oftentimes still for what is now a 988 call, ambulances are called first at 911, and it's really a mental health emergency versus the 988. So just making sure that they're aware and informed that they could bring people to that emergency room for triaging for a mental health emergency.
Awesome. Thank you. Yes, yes, yes. So yeah, thank you for that. I didn't even think of that actually, but yeah, that's a good one. Keep informed.
Can you place one more, I mean, more than one? The stakeholders? Like I'm thinking HRSA would also be keep satisfied or keep informed.
Yes. Mm-hmm. You could. Yep, yep. But I guess what I'm thinking about when I'm thinking about this grid and this is level of engagement. So how do we engage the stakeholder? So I think that language kind of if the team gets on the same page as far as this having this language, or you can have different language, it kind of helps identify, meaning the monitor, they keep informed, manage closely, and keep satisfied. It kind of helps the team identify like what is the intensity of our engagement. Is this, and usually comes down in my mind, is it somebody that we have to have an monthly meeting with, monthly email, yearly update, or is it something we're going to meet every 2 weeks? And so forth. So from that perspective, that could help the team kind of not to get overwhelmed, and create those structures of how we're going to conduct this work from very beginning. And guys, you're all aware, sometimes we think of one thing and then we plan and do, and then we recognize, okay, didn't work out, and we needed to this is an opportunity to learn, and here we are, we need to include more stakeholders, or maybe somebody who was very important to us in the beginning now needs to be just keep informed because the step of the work has been completed. So it actually very fluid and changes with the work is being done. I'm probably forgetting something. Jen, is there something else that we wanted to add to here?
Christina made a really good point too. So it really depends on your structure as well. So we could be giving one example of, if you're embedded within a hospital or working really closely with one, the relationship with those stakeholders might look very different versus, maybe a completely different setup. Even if you're a team who is approaching more of a school-based approach, again, emergency departments may be a part of your stakeholder group, but they likely wouldn't maintain kind of the same relationship as you would with your schools and vice versa. So thanks for bringing that up, Christina. I think that's a great point. When you're doing your analysis, it really is dependent on your structure.
Yep, absolutely. All right.
Want to keep going forward?
Yeah, I don't see any more. Looking at the, I'm not seeing any more in the chat. Okay. All right. Well, thank you for participating in this. Um, so, so why? I just wanted to maybe digress a little bit. So why do we talk about stakeholders and in especially in the beginning of our projects and thinking through this model is because without stakeholders, our work probably will be impossible, right? So um, getting them involved early is the beginning of the QI work actually. And using the QI methodology is one of the steps that we wanted to do before we dive in any further steps. Okay, and now that I've digressed, we're going to talk about paths of AD engagement. So there are different paths, right? We in the folks who've been with us for a little bit recognize that this year is actually our new ways of exploring the ED space and helping one another to recognize that could be different paths we can take with ED space. Extension projects. The first one, or just the one, they all important, education and training, teleconsultation is another one, and another one is patient resource connections. Is the community focus where we're looking at all there is to do, and there is a lot to do before the hospital admission and after the hospital admission. So there's a lot of interventions and opportunities to be done before that kid ends up at the ED steps and after they've been discharged from the hospital. Next slide.
Sure. And one thing to add with that too, first, these are kind of our summarizations of what we've learned from teams in terms of what they're offering to providers. Something of note, though, is when we participated in the ED Stop Suicide Collaborative, those emergency departments were surveyed. There were questions specific, and Eleni, feel free to chime in. You definitely know this detail better than I do, but they were asked about, different teleconsultative services. And do they use them? Do they find value in them? Or are they aware of them, and how would they like to see something like that be beneficial to them? Consultative services for sure, but I think something that was really important was that third bullet here and that resource connection. Not to say that folks aren't interested in the consultation while in the ED, but they're just as concerned, if not more so, about what happens to that patient after and how are they getting connected to services outside of the ED or back with their primary care provider if they have one. So keep that in mind as well.
Thank you. This is a great addition. Yes. Yep. All right. So to get us started, one way we're gonna do this work is asking questions, right, and exploring the EDs. So there's some questions we posted here. They are not the only questions, but that you can use. But certainly ones to start thinking with as you're expanding to the EDs. And again, those should be tailored to your team's interests. But this is where to kind of guide you through this thinking process. And we will be sharing the ideas that we've gathered in the last year of questions that are being asked of EDs by different pediatric mental health care provider teams, program teams throughout the US. We've collected them and organized them. So we'll share those as well. And they are located at all times for you on our website, in our toolkit. And I know I am forgetting something here.
No, you're good. And again, these are just some initial questions to brainstorm. I'm curious. I know, Anne, we heard from you just about your stakeholder engagement. Is there anybody who's having struggles, either one, in identifying the right stakeholder groups, or two, you're starting to have conversations, but you're feeling like they're kind of stalled out or not really going anywhere? Is anyone facing any issues like that right now?
So no barriers, huh? Okay.
Okay. How about in your, if you're not currently doing EDs in any of your current work too, I don't know, what are some of the tools that you might have applied to get you kind of past those barriers? Has anyone done a kind of stakeholder analysis before?
I think looking at just a community needs assessment, if you are able to look at what resources are currently available, and bringing those community members together in even the first fashions of doing the community needs assessment, interviews, stakeholder interviews. And then when you start to identify what your program can bring or offer, does it fill a need? Is it even needed? One part, and then the other part is how can everybody collaborate?
No, I love that. And definitely leveraging your community's needs assessment, especially going through the hospitals. They all have to complete them. Well, if they're a nonprofit, they have to complete them, I think, every 2 years. So that's a great resource to access. Even if you're not working with emergency departments, that's a great resource. All right. Well, if nothing else, we can move forward.
I'm just going to ask a question, and it could be for now or future input. So we have peer advisors and peer specialists on our statewide advisory group. So just thinking about how to engage them in our planning process and what would be helpful. We haven't done that yet. They've mostly just been attending to get information. So you've been keeping them informed, but thinking in terms of engagement be helpful to get feedback on.
Well, I was wondering if anybody on the call here has had success or had engaged. We do have a parent engagement through the EIC, Jen, and I'm forgetting the name of this group.
Someone we can get you in contact with.
Yeah, Annie,
from
we do have someone we can help
Yeah, so through
get ideas.
the EIC and like the overarching EMSC network, there's the Family Advisory Network, or the FAN. We have an individual who runs that program and is specifically tailored to bringing in the family voice. And then she's part of the larger just advocacy in general. But she might be a good one to connect you with, just in terms of how do you engage and what meaningful engagement looks like beyond, just sitting in a room and listening, which is good for a time, but I'm sure you're ready for the action part, and I'm sure they are too. And I know a lot of the fans are engaged in different projects within their communities. So our colleague's name is Jennifer Talley. We can definitely get you in touch with her.
Yeah, she might be able to provide that insight when it's the time and how to do it so it's useful, or I'm looking at this what's in it for me approach. How do we help each other to do better? Yeah. Okay. All right. Thank you. I forgot the name. Thank you so much, Jennifer.
Sure.
All
And then,
right.
Gabby, I said that you dropped a chat. Barriers for engagement can also be something to think about. Would you like to elaborate on that, or is that just more of a kind of a comment?
It's actually tied to Anne's comment. Maybe thinking about what barriers in terms of maybe identifying it. There is a need, but maybe there's also a barrier for a complete engagement. Like, for example, training and hours available, or funding on other ends. So maybe taking a look at that as well.
Good point. Yep.
I can also just add something that was interesting. We have our director of diversity, equity, inclusion committee within our Michigan medicine system on our advisory committee, and she sits in on the meetings with our hospital sites. And we had our list of questions asking about workflow and all kinds of things and wanted to know the barriers. And then she jumped in and said, what are the strengths? And so it was a good reminder of like to ask that as well, because we certainly could identify lots of barriers, but it was really good for the hospital site, that those in attendance, to be able to think about their strengths, given how challenging things are for them.
For sure. And I think,
Well,
I
and
think-
it's also, I like that. I'm sorry, Jen, I'm gonna
Go ahead.
say
Yeah.
it because it brings what Anne said, it brings a different perspective, right? There are some things we are actually pretty good at, right? In hospital settings, when the kids are admitted, for example, we have very little rates of them continue harming themselves. That would be one positive things to look at. But then there's other opportunities out there. And I'm sorry, Jen, I interrupted you. I just thought of it as she was describing talking about the strength of the organizations.
No, you're good. Again, nothing like a good SWOT analysis, because again, I think we get so focused on the barriers to implementation that we don't focus on what could actually go well and what acts in our favor. And I think that's where, and this goes a little jumping ahead, but I think this is where, like process improvement methods can really be helpful. Because then you can conduct a needs assessment, you can get all the right people at the table, you can conduct a needs assessment or get that data and take a look and say, okay, we've identified the need. And then you begin to try to develop a plan for it. And then you might run into the barrier of like, well, people don't have time, or like, this is a nice to have, but we're not ready to implement it. Where this is where you can test out those smaller tests of change and take even smaller bites before implementing something more broadly. So as you're introducing new change concepts to your teams, even taking the simplest step, like you might just be ready to, look at educating on a new, suicide screening. Before that, you might even just do like a time assessment to see what kind of time they have in the ED to even do that assessment, or even, have that time to dedicate towards the patient. So the thing that you're thinking of doing, even take a step back and say, how can I make this maybe a smaller test of change to implement in my work?
Good points. All right. I think we're ready for next slide. So what are your next steps? This is how our step one of our toolkit looks like on the right. And hopefully it could be used as a guide, a suggestion, ideas as first steps you might want to think through before you begin a ED expansion project, or even if you're in it. Maybe there are some things that reminds you, oh, we didn't think of that. So that could be an opportunity to kind of take a glance at this. Our toolkit is now published and available to everyone. So the review of the step one of the engagement of the EDs is conducting stakeholder analysis, just what we just did today. And the next one is to create a needs assessment. With that, our next slide will go into stakeholder analysis interview form. Could be helpful. It's already ready to form to go and play with, or you can add it as you need it, but it gives you an idea of how do we want to go about it. Anything I'm missing about this form, Jen?
No, and again, this is just a template for you to work off of. Again, there might be other areas that you might want to consider, but it's a good starting point for when you're even just going to these stakeholders and sharing the work that you're looking to do and how you want to engage them.
Yep. And the next opportunity there is the needs assessment. I talked about this a little bit in the beginning. So we have created a bank of questions that we've gathered that was available to us, and we organized them, and they're also on our toolkit web page. So we organize them by themes, so ED provider education theme, ED services theme, and just general ED questions you might want to be interested in as you begin to administer those needs assessment. They're not all inclusive. So, and we said it from very beginning, there are going to be other things that will come up that we will adjust and add it to this bank. But just to let you know, those are available if you wish to choose to use them.
I think something else to add too. So in creating this document, not only informed by our own subject matter experts, but really looking to you all as well to see what you've implemented, because a lot of teams have already conducted their needs assessments. And it was very interesting to see how some approached it. Some did a very sweeping needs assessment to really just figure out what emergency departments were looking for, and they were open to any and all things. Others were very specific and tailored their needs assessment to the things that they knew they could provide to these hospitals. So as you're thinking of needs assessments, if you haven't yet conducted one, or you might be in the process of, hey, maybe we need to do another one because we need to get more specific, think about kind of those two trains of thought when you put this together. There's probably more trains of thought too, but two considerations.
All right. And so with that, to explore opportunities in the ED, our toolkit provides examples of real-world applications through the ED care paths. So what we've done is, remember in the beginning, we showed an ED care workflow. So what we've done, we've matched what we've heard from you, from the teams that we've partnered with last year, and found some of the hypothetical, and just want to stress this out, hypothetical examples, how the team can contribute during different stages of a ED care pathway. We also added the last third column describes element of considerations for each care pathway step in the ED. So it kind of helps you, it's basically a written document that kind of gives you ideas on what are the folks could be struggling with in the ED environment, and what are some steps that my PMHCA program can contribute to. So, and again, this is just to aid this work, and I think is a great way for the first few or three first steps. All right. I think we are at the good juncture to take a break, or am I wrong? I was gonna
No.
give them a little bit of a break.
No,
before we
you're
move on.
good. I had one more thing to add here, and then the other slides are just resources. But again, some of you have heard me speak about this ad nauseum, but if you haven't read it yet, the Critical Crossroads Toolkit, which is a HRSA created resource, it is specific to the emergency care workflow as it relates to mental and behavioral health. And so the workflow that you saw in the beginning, as well as the application here, is really pulling from that resource. That resource is very ED specific, but it is still highly beneficial to PMHCA teams because you'll get a better understanding of some of the clinical considerations that EDs are trying to make when they try to incorporate some kind of mental and behavioral health intervention in any step of, the care flow process. If you haven't looked through it, highly recommend it. It'll also make this a little bit more connected as you work through it.
All right, and just wanted to I remember to forgot to say this. This document was created with you in mind, but as well as with assistance of our emergency department social worker, Angela, and others who are in breathing and living the emergency rooms environment and struggles that folks are going through regarding pediatric mental health emergencies and care for our community and for our kids. All right, with that in mind, resources for you. That's right. The reminders are fireside chats. This is a snapshot of what you'll be able to find online. The link Hannah has provided, I believe, earlier in the chat there. But it has a wonderful videos. I think one about an hour, 50 minutes to an hour long, but it gives you, again, a little more perspective of some of the opportunities and some of the standards of practices that ED staff is involved with. And looking at as an opportunities to improve and or develop. All right, I have to plug that in. Our next webinars, in case this is the only hour. This is the first part of that office hour that we talked about in the beginning. So if folks are not able to continue to stay with us for the next hour, this is a reminder that the next office hour will be on May 2nd, and we will be having our data analysts joined with us, and we'll be looking at different considerations teams might need to think through when we are selecting different data software platforms. So looking beyond Excel spreadsheet and what's out there and what to think before we select a different platform. On May 7, we'll have a part 2 webinar by Trevor Covington. He will talk about pediatric needs during times of disaster. And if you haven't listened to Trevor before, he's an outstanding speaker. He had his first webinar, I believe, in beginning of the year, January. So it's on our website. Check it out. On May 14, we will have a webinar about presenting your work publicly. I know many of you are going to be going to the June meeting for GBS HRSA, I believe, beginning of June, and then we'll have opportunity for some of the teams who are participating in our collaborative to come and join us in Cleveland in July. But this a webinar will provide a basics of how to research and begin putting the abstract and presenting the work, that outstanding work that you all do every day, every single day, that needs to be shown to and shared with others. So please join us on May 14 for that. And I think we are ready to stop recording and take a break and come back at 4:02.